Hi, my name is Marty O'Shea, and we're here for the latest installment of the Superintendents Corner. And today we're together to talk about an issue that is important to us locally and certainly is part of the national conversation as well. Specifically, we'd like to talk to the community today about the prevention and intervention efforts that are underway here in Longmeadow to help us create a drug-free community. And so with me today, to my immediate right, is the Coalition Coordinator of the Drug-Free Community Program, Paul McNeil. And also with me is perhaps a familiar face. Shelly Warren is our Substance Abuse Response Coordinator and also the President of the Close Coalition. And so we're excited this fall to learn that Longmeadow received a highly competitive federal grant called the Drug-Free Community Grant. And Shelly and the Close Coalition were very instrumental in creating that grant, authoring the grant, putting together an action plan to support that grant. And so I'd like to acknowledge the work that Shelly has done as the president of the Close Coalition and her entire coalition for putting together an outstanding grant. Sue Bertrand, our assistant superintendent for learning, was also an important author of that grant. So we're excited to receive this grant, and we think that it will support some very important prevention and intervention work in the years ahead. And so that's what we're here to talk to the community about. And Paul McNeil recently joined Longmeadow Public Schools as the coalition coordinator and will help us execute the conditions of the grant in the next 5 years. So Paul, you've had some great experience with the Drug-Free Community Support Program, so maybe you can tell us a little bit about the grant and the program.
Sure. I'm proud to be here in Longmeadow. It's the third community I've helped with this federal Drug-Free Community Support Program funding, and I've found success in each community I've worked with. And the federal funding has been around for about 20 years. It's incredibly competitive. This year, only 99 communities were awarded these funds. It's $125,000 a year for at least 5 years, and we'll have a chance to apply for 5 more years with being able to show success for the first 5 years. So I'm very optimistic that will happen. A ton of people are on board with this coalition already, with all the incredible work that Shelly has put in with other folks from the Close Coalition. And it's a coalition model that basically involves 12 sector representatives, everything from law enforcement to business owners to youth to parents to the health sector, and we bring these 12 leading sector representatives from the community together and try to find responsive ways that we can respond to substance use as a youth behavioral health issue. We're not really into saying just say no to drugs. I think the focus of our work is actually reducing the barriers that help young people find really healthy, sustainable ways of growing up and finding happiness and well-being, and trying to decrease the risk factors that would lead young people to using substances in order to feel good or better. So
when the Close Coalition brought to us the opportunity to apply for the grant, one of the things that we were all excited about is that it would allow us to kind of build on some existing directions, some existing programming. It would allow us to work with the local community. And I think that's my understanding of the grant. That's one of the great strengths of the Drug-Free Communities Grant Program, is it allows for local solutions to address local problems. And I know, Shelly, you've been deeply involved with this work on a local level for a long time, so maybe you could talk a little bit about that.
Sure. Well, one of the things that's exciting is it enables people in the community who are already doing work on the protective factors and to reduce substance use to start to work together. So while the schools does a tremendous amount in terms of health education and parent outreach and even early intervention with students, we're now able to partner with other people in the community who have a different piece of the puzzle. So we're able to work together with law enforcement, with the Board of Health, for example, with faith-based communities, with parent groups, and so on. So it's kind of taking people who are already doing good work and bringing them together and helping them to combine their efforts.
Yeah, no doubt.
It's been exciting.
Again, local problems, local solutions, and I'm excited. There was already a lot of momentum in this direction, and this will energize that work even further. So The other thing I think that's important for folks to understand about the Drug-Free Communities grant program is that it relies on evidence-based strategies. And so there's, this program's been around for a little while, and I think there's a fair amount of evidence that the intervention strategies that the grant supports actually work. And
yeah, every community that has received funding over the last 20 years has seen a decrease in 30-day reported youth alcohol use, marijuana use, tobacco use, and prescription drug use. And so Longmeadow, we believe, will be no different in that successful trend in decreasing youth substance use. Yeah, everything that is implemented by the coalition as far as funded strategies, it's all evidence-based. So we don't really take on a strategy unless we know that it has worked in a comparable community in the past, and then it's a vetted strategy. For example, the social norms campaign, where you take data around local substance use in Longmeadow, around perceptions of behavior. So for example, let's say 12th graders think that 80% of 12th graders are drinking alcohol on the weekends, when in reality the data shows only 10% of 12th graders drink on the weekends. And a social norms campaign will highlight that gap in perception so that more students are aware of what the actual healthy protective factor numbers are, that most students are not drinking or using marijuana or other drugs on the weekends. So that's one evidence-based strategy. Another strategy would be just implementing a comprehensive curriculum in a school district like the life skills curriculum, which addresses not just substance use education, which is something the elementary schools have taken on this year with some additional funding that's been leveraged in the community. But the life skills curriculum tackles all sorts of issues for young people, including building resiliency skills, self-soothing, stress management, self-advocacy, standing up for your peer group. And that's how we're going at substance use with young people. It's not just changing an individual's behavior, but it's sort of changing the environment that everyone's sort of raising their families and young people are growing up in.
Yeah, and Paulie did a nice job, again, of kind of articulating how this program will build on some existing strategies, whether it's the life skills program that is introduced through our elementary health program, or through the social emotional learning frameworks that exist in all of our schools. And so this work will nestle nicely in that existing framework. So, Shelly, again, an area of expertise is I think you understand more than any of us really what the local conditions are. And we know that we're not immune from youth substance use, and there might be some things you'd want to highlight in that area.
Sure. As a part of the grant application process, we had to do a community-based needs assessment. So there were some local conditions that emerged from that. One of them being access. So we have more access than might be typical because of a number of reasons. One of them is a higher rate of disposable income. We're also located within a high-intensity drug trafficking area geographically. We have, our youth tend to have more access to places where they may be able to use, and also to more outlets. So for example, we see a big trend right now with the use of electronic nicotine delivery systems, but our analysis showed that we actually have 16 retailers within a 4-mile radius from the high school itself. So we're in a kind of saturated area, for access to that product. We also have very high achieving, very involved students, which is a protective factor in a lot of ways. They're are very invested in their future and are doing a lot of positive things. But we also have higher rates as a result of sports injury, which can be an entry point for prescription pills, and just access to good health care, which can also be an entry point, though, for the prescription pills to come into the community. Another area that we've seen a focus on is parent perceptions. So wanting to do more outreach with parents, to decrease the likelihood that they would view some of this as a rite of passage. Because with what we now know about brain development, the risk that you take on when you use young increases the chances that you will have problems related to that substance later on. So trying to educate parents about those risk factors as well.
Yeah, and what I've learned from Shelly and others that are involved in this work is that notion of trying to reduce the risk factors and enhance the protective factors. And it seems to me that that's true at the individual level, but also at the community level. And so when you're talking about reducing risk factors at the community level and enhancing protective factors at the community level, that's where it's really important to have the coalition in place and to have all the sectors represented. Again, whether it's local government, youth-serving agencies, local churches and synagogues, that all of these groups potentially can be partners with us in this work. And so I think that that's really, really important. So, certainly we know that the statistics that Shelly articulated so clearly tell us that Long Meadow, like other communities, has an issue in this area. If we had to peel that back and understand what the root causes are of youth substance use, what would some of those root causes be, either locally or just generically or generally?
Well, the data that has been collected in the community climate surveys in the past few years has shown pretty high levels of self-identified stress or anxiety as root causes. It's pretty high stakes academia here in Long Meadow, and a lot of students are aware of that and sensitive to that. And if you're not taking a particular medication to help with, doctor prescribed, focusing, then sometimes those prescriptions can be shared as sort of study drugs, and that's something that is very prevalent in really high achieving academic communities. But as far as smoking marijuana or using marijuana-based products or drinking alcohol on the weekends, sometimes when you have this sort of study hard, play hard mentality, then it's sort of a party hard on the weekend. Sort of, we've earned it. We've earned the right to let our hair down on the weekends. Sometimes that sort of falls into place. And another thing is alcohol use in the household. I think we're seeing about 1 in 10 12th graders in Long Meadow that have used alcohol in their household with parents' knowledge. And that sort of shows you that rite of passage idea that Shelly was talking about, where parents thinking, well, my kid has worked hard enough and long enough and they're old enough where they can have a drink. And that's where we're starting to see a lot of changes with our understanding of brain development, where it is really important for parents not to show that alcohol doesn't have risks with their teenagers. And it's not a great modeling, drinking alcohol in the household has a little bit of a counterintuitive outcome, where young people have a perception of, oh, it's not that bad, when in reality they need to think, alcohol could be potentially really harmful until my brain starts to slow its development, 23, 24, 25. And until we change the drinking age to 25, we're stuck at 21 for now. But delaying or decreasing use is incredibly important. And we're not naive enough to think that abstinence is the only policy we can take. We really are interested in reducing harm. So if someone's already using a substance and they're 14, 15 years old, we want them to decrease use. If someone hasn't used a substance yet and doesn't want to yet, let's delay their age of initiation. It's going at these substance use issues comprehensively like that. It's going to be successful.
Anything else you've seen, Shelly, in your experience in terms of the root causes that contribute to some of the factors?
I agree with what Paul said. One thing I might add is that we do have, I think we had 26% of our seniors last year report signs of depression. So I think there's a self-medicating aspect for some students, which is worrisome, because there's experimentation, but there's also when you're using to change how you feel, which sets you up at increased risk as well. So I think that aspect, and definitely this grant is geared towards supporting students socially, emotionally, and developing those programs in the school. So addressing some of those underlying causes, I think, will be key here.
And I think that's where sometimes you can, in developmentally appropriate ways, you can bring this conversation down to the level of young students. If we have opportunities to teach them about taking healthy risks versus unhealthy risks, or if we have chances to talk to them about stress management or coping skills or resiliency, those are things that you can teach to the youngest of students in Long Meadow Public Schools. And if you're able to develop, those habits at an early age, perhaps you're going to have some success down the road and help them avoid making unhealthy choices. So, so the work of the coalition. This is a 5-year grant, and there's a lot of work in front of us. There's some work behind us, but there's plenty of work in front of us. So, what are some of the? We've talked a little bit about it, but what are some of the strategies that the coalition will be involved in with the support of this grant?
I think we're going to continue to leverage the existing strategies, which are everything from a safe homes directory that the parents have organized to a safe substance-free prom, after prom party. Those sorts of things in place are huge assets to this community. What we'll add to it is other evidence-based strategies we know that decrease youth substance use and increased protective factors like parent education, helping support parents in how to address the issue of substance use in their household, how to talk with their teens about really difficult issues around substance use. Because there's something about after middle school, a lot of parent education sort of tapers off, and it's like, well, they're old enough and my job is done in a lot of ways developmentally, but it's not. It's still incredibly important to have a really positive presence in your teen's life. So parent education, social norms campaigns, which have already been taken on by Tom here at the high school level, are really instrumental, not only in the high school or middle school level, but for parent perceptions. So taking, again, that healthy behavior data that we have really high percentage of practice from the parents and from the students, and highlighting that so that students know, oh, most students are making healthy choices. Parents knowing most parents are actively, positively involved in their teens' social interactions and weekend activities, and highlighting those numbers so that the gap in perception changes and eventually the behavior starts to change.
The best example I think that Paul has provided is that parents need to know that they're in the significant majority if they call ahead to a friend's house to make sure mom and dad are going to be at the friend's house, so that, sometimes parents need that positive reinforcement as well. So I think that could be an important component of that social norms campaign. Any other activities?
Yeah. Well, I was going to say our plan too is to involve youth. The youth sector is one of the partners in the coalition, so we hope to involve them in a social media campaign and getting some of the social norms materials out. If they're able to identify strategies that work and ways to get young people's attention, that will greatly help the coalition. And we're excited that we have 5 youth sector representatives. So we already have good representation on the coalition of teenagers. So
we only got a couple more minutes. First, I want to again acknowledge and thank you both for the work that you've done as community leaders in this really, really important area. So thank you both. Any upcoming events that the coalition has planned that we ought to plug at this point?
Wednesday,
yes.
January 31st at 7 p.m. at Storrs Library. We're going to be having a community-wide event. There will be some education and there'll be some panel discussion, and there really will be some breakout discussion as well for everyone in attendance. And what we're going to be talking about is substance use, basically as a human condition.
So thank you for watching at home. If you have any feedback or questions for any of us, certainly reach out, and we'll see you in the next edition of the Superintendent's Corner.
Thank you.
Thanks.
All right.